am the program director for the Tobacco Action Coalition of the Finger Lakes. I began this position with the American Lung Association in June. So I'm very excited to be in this role because I'm also a nurse by trade with a background in health administration. So it's a great collaboration of my skill set.
That sounds like a great collaboration. So talk to me a little bit about some of the things that are top of mind for you right now.
So top of mind with our coalition is the It's Not Just campaign. And that is a campaign where we are raising awareness to the inequitable marketing tactics of menthol to specific targeted communities. Right now, we are focusing on the LGBTQ plus community, but this campaign has been rolled out over 3 phases because there is targeting towards the youth, the African American population, as well as the LGBTQ population.
And can you talk to me about some of this targeting, like what it actually looks like and what it means?
Yes, so targeting looks like historically there was a project that Big Tobacco used called Project Scum, and that's SCUM, and that's subcultural marketing that they use. It was an internal project where they particularly marketed to the LGBTQ plus community, those who had unstable housing and who were homeless. So it also included the other communities that I've listed before. And what it looks like if you were out in the public in stores, you will see all of these very colorful, flavorful products all over the counters. The advertising is very youth friendly. That's one population that is a target. And the average new smoker is 13 years of age. In New York State, we have 1 in 4 high school students who are already vaping. So the marketing tactics are working. They are aware of what they're doing. And, we want to bring awareness and start a conversation amongst our community as to these tactics so people know that they are targeted.
And so, I guess what can we all do? Like, I guess someone like me, so I'm not a parent yet. But if I were, I would be probably wondering what's the best way to have a conversation with my child about tobacco use. So, like, what would be your, I guess, advice for parents on how to have conversations, have good and impactful and meaningful conversations with children?
To be open and honest in the conversation, just to make them aware. Many youth, may not be aware, many people in the community may not be aware of different dangers of vaping. We're out in the community and we are tabling at different schools, at different events in the community. And some of those people who do come and speak to us who are smokers or vapors, they're not aware that vaping also gives off secondhand smoke. A lot of people aren't aware of that fact that can happen. Just having the awareness when you're out in public, seeing that those colorful things are attractive to the eye, more particularly maybe to the youth or even to an adult, and it's part of that marketing tactic that's used to draw you in. The menthol itself is used because it's supposed to be flavorful and it makes you more apt to use it and harder to quit. So it's easy to draw you in and harder to quit. And, Big Tobacco is looking at this generation of people as being their, next group of addicts to their products.
Yeah, it's a tricky thing because it really is. I mean, there's addiction on, we were just talking about on our show just like about caffeine addiction. I mean, there's so many different, addiction manifests itself in so many different ways, but it's really tricky. Like addiction is tricky.
It's easy to overlook, but
Mm-hmm.
hard to get caught into the cycle. I'm just throwing out some different statistics for you when we say that Big Tobacco is targeting these different populations. More specifically, the LGBTQ, they're using these products at a higher rate compared to their counterparts, as well as the African American population. I believe they have one of the most alarming statistics where they're using menthol products at about 81% and compared to 29% of their counterparts. And that all goes back to the marketing the targeting, and how big tobacco specifically uses the LGBTQ community appearance as an ally, because they are funding pride events, they are funding festivals, they are funding HIV research and work, but they are also aware that those who live with HIV can progress to full-blown AIDS, and smoking accelerates that. And they are aware of that, but they're allying with them to make it seem as if they're helping, but it's also drawing them into their products at the same time. So those tactics can get very slippery, because these communities may say, yes, they're funding us, they're supporting us, but they're also putting their products in your face and drawing you into using them.
And so what do we know about tobacco use in the Finger Lakes specifically?
So the Finger Lakes, so our coalition covers Seneca, Ontario, Wayne, and Yates. Those are our areas. I know that Wayne County specifically is about double the rate in smoking as for the state. So the state is roughly at about 10% smoking rate. Wayne County is at about 20 plus. We are doing a evaluation piece. It's a survey in Ontario County specifically this year going into next year, where we'll be surveying the community, asking different questions about, their attitudes about smoking tobacco, if they're aware of certain things, how they feel. Those things we do every year. We typically focus on 1 or 2 catchment areas within our area. And that information we take and we use it to educate, like I said, our community. We use it to educate those local politicians who may not be aware that, look, in this county, you're double New York State smoking rate. That's a concern. We're focusing on Ontario. Like I said, this year, they're our second highest smoking county. So we plan to take that education and compare it from the general population of Ontario County, but also looking at how does the LGBTQ compare in those results. And that's information we plan to take back to our community and use to engage and educate.
And so I guess what would your message be for people, like if they're well, you know what, before I get into like your big message, might seem like a silly question, but why is vaping bad for you?
Vaping is bad because it's going to cause cancer. We know that tobacco use can cause over 16 different types of cancers. So that's huge when you think about these one type of products causing 16 different ailments that can affect you for the rest of your life. I know that, like I said, with the smoking, it accelerates HIV into AIDS. It also accelerates those lung issues into emphysema. And emphysema, easily explained, is just in a lung condition that causes shortness of breath. And a lot of people have to live with that the rest of their lives. So there's a lot of health ailments and things that can make you terminally ill from these simple, well, not simple products, but products that are particularly marketed out there to these communities.
And so now moving forward to like, what's your big message? Like, what most would you like people who are living in the Finger Lakes to know as the representative of the Tobacco Action Coalition?
We want them to be aware. We want them to just have more conversation, to be educated if they are not. Tactful is what we're known for, shorthand. We are available as well as other resources. If someone was looking to quit smoking, we would first recommend have that conversation with your healthcare provider, because it's important and the best way to move forward in doing so. But we also are available in the community to come out and educate in different types of platforms to the youth, to healthcare providers who may not be well versed in the tobacco realm. But just to have that conversation, just to be aware, we're not trying to lobby to ask for anything specific, but we just want to get that awareness out there and let this be known that it is a big concern and a big deal.
Wonderful. Is there anything else that you want to add, or anything that I should have asked you that I didn't?
I don't believe so. I actually appreciate the opportunity to come and speak about it. I hope people who weren't aware of us before are now aware. And if they'd like to reach out to contact, we are smokefreefingerlakes.org. That is our tactful website. If they are looking for support in quitting, as I said, speak with the healthcare provider first, but lung.org has a plethora of resources that can be used. I know there is a vape quit line, a text line, a smoking quit line. So there are resources available, and sometimes people don't know where to start. So I wanted to put that out there.